Good evening to everyone. So, today we will discuss something about the rabies, a comprehensive analysis in view of the World Rabies Day, that is in the year 2024. So, in view of this thing, we will have a brief look on this particular aspect and also see what are all the things need to be discussed in the rabies as in a world scenario. So, about 4,000 years back, the rabies had tortured the human lives. However, it only the 1,500 it was suggested that the rabies transmitted through broken skin through animal bites. But it was thought that it is also the toxicity of the dog bite. But in the year 1885, when the Louis Pasteur, the eminent scientist who took the initiative of finding the first effective vaccine against the rabies. So, in India, the first Pasteur Institute was instituted in the year 1900, of course, a 24 years back, 1900. Now it is 2024 and became the center of attraction of treating rabies. So in India, in 1907, for the first time, anti-rabies vaccine was produced. So, however, after many years, rabies control efforts in India have been under the 11th 5-year plan, where there was a promise made to control rabies in animals, and their vaccination was talked about. But in the year 2006, there was an introduction of nerve tissue vaccine, and now lot of improvements are done in the diagnostic aspect of the rabies and also the different updates about the vaccination schedules and oral vaccines, and all these things are being already under the trial. And in view of this thing, the World Rabies Day is there, and we'll see some of the points, especially everything everywhere it happens on September 2018 as a routine thing in entire world. It is happening, and we are also doing it. So rabies, it's a bullet-shaped virus with the structure as it is looking in this particular slide is concerned, because it is having, if you take the cross section of this thing, the outer coat is having the glycoprotein, then followed by the matrix, then there will be a lipid bilayer, the rhabdovirus. Then it is also another. So this is the bullet-shaped virus, and it has got the last protein and nucleocapsid RNA, and it is about 80 nanometer to 170 nanometer, belonging to the Rhabdoviridae family. Everyone knows this particular thing. And the susceptibility of the rabies virus in the order, it is inactivated very fastly at 60 degrees Celsius within 30 seconds and sensitive to pasteurization and boiling. So even the especially the pasteurization temperature, it is going to be lost, and at the pH 4 and the 10, so it is getting inactivated. So it's a very fragile virus, and hence action of oxidizing agent, and most of the time the solvents, the soaps, detergent, then the many of the proteolytic enzymes, UV rays and X-rays always destroy the virus. And apart from this one, the most easiest thing and available are the soaps and the detergents, especially the alkali soaps and the detergents are always going to kill the virus without any problem, and they are easily available, and alcohol also inactivates the virus. Then the preservation of the virus by freeze drying, it can be kept at ultra low temperature minus 20 degrees Celsius, and also it can be preserved in glycerin as one of the reagents. And we know that a lot of data is available on the global data, then different country data is also available in different websites, as you can see that the human rabies versus the dog rabies, always it is West Africa we can see here the human rabies or the unvaccinated dog percent is also very high, and the human rabies is also very high. So as the things go on increasing in Eastern Europe, unvaccinated dogs are less, but the uh, susceptible people are also less. And when coming to the global scenario, the unvaccinated dogs population is very high. Then human rabies deaths is also relevantly it is high. This is a qualitative study, and here you can see that the Western Africa, it's so of course the Middle Africa, totally the African countries, the incidence is high, but the Asia also doesn't lag behind. All the Central Asia, Northern Asia, everything it is there. Whereas coming to the West Europe and Southern Europe, the incidences are somehow rare. Then rabies is responsible for significant mortality and morbidity, 100% mortality. So rabies is endemic in the country, and human and animal cases are reported throughout the country, irrespective of the state, etc. So throughout the year, except for Andaman and Nicobar and Lakshadweep Islands, the reports are less. So in India, about 96% of the morbidity and mortality is associated with dog-oriented rabies only, and the remaining 4% may be from the other sources like the mongooses, the wild animals, and also the rats or other animals. So the rabies affects the people of all age groups, and children are highly susceptible for the dog bites because always the dogs chase the children and bite them. Hence, they are highly susceptible in the group. So 40% of the people exposed to dog bites in rabies endemic areas are there. And rabies, if you see this thing, especially is 100% mortality is caused by rabies, whereas the different diseases, the mortality rate is less. For example, tetanus, diphtheria, tetanus, then Japanese encephalitis, H1N1, all these things do cause very less mortality when compared to the other thing. So the World Health Organization estimates India accounts for 36% of the global and 65% of the human rabies deaths in the Southeast Asia region. So this is very high mortality, and we need to focus on the dog menace and also from the other preventive sources like the vaccination, etc. Then here there is an estimated that about 20,562 human deaths are due to the rabies, especially in the India. Average it is there, and here in this particular chart you can see that which are all the states which are highly prone for the death of the rabies. Especially here you can see that the countries, the states like the Maharashtra, then Gujarat, very high mortalities from the rabies is there. So India has estimated that 12,700 deaths due to the furious rabies, or as you know very well that there is a dumb form of rabies and furious rabies. So every year it is average 12,700 deaths occur due to the confirmed rabies death. Sometimes the unconfirmed kills also go unnoticed. About almost the 2.3 million people annually receive post-exposure prophylaxis after the bite is always there. So the very rarest country, they or sometimes here you can see that the rabies is not there. That doesn't mean that it is rabies free, but the data may not be there in such states like Uttar Pradesh, then Uttaranchal, etc. Whereas uh, the death rates are always there, and the rabies cases are always. Then many times it goes unreported also. So the animals transmitting rabies in India are the most number one is the dogs, followed by the occasionally cats, then monkeys sometimes they bite, then the cattle and buffaloes sometimes they are also affected and they are not going to bite, but the veterinarians or the animal attendants will put their hand inside the mouth, and if they are wounded and they get infected with the rabies, then the mongoose, always a source of the rabies to the domestic animals like cattle, etc. Then foxes, wolves, and jackals play an important role in transmitting the rabies from one animal to another animal in case of the wildlife. And sheep and goats are also unable to bite, but they suffer from rabies. And because they are the dead end horse, they are not able to transmit. But the human accidentally puts his hand, and if he gets a bite from sheep and goat, may get the rabies. And occasionally the bears, the wild animals, the pigs, donkeys, horses, camels, and also the spotted deers are also one of the sources of the rabbit. And the squirrel, here you can see that one case is reported in the India especially. And the deers are also bite by bats or rodents, do ordinarily responsible for the rabies in India. But the bites by bats or rodents in unusual in may be considered for vaccination consideration in an expert in this field of rabies. So the bats and rodents, so the data is lacking. Sometimes the rodents may also bite if they do suffer from the rabies. And birds, it is not reported as on date. As on 2020 data, it is not reported, and later we do not know. And Louis Pasteur is the one who collected the dog saliva for testing of the rabies virus. Of course, at that time, no facility was there to get it identified or to see, because this the virus is one of the smallest organisms which we cannot find it in the naked eye or under the microscope, ordinary microscope. Then usually rabies bite, always it is updated that rabies will come after the bite of a dog to any of the muscles. Then it will traverse through the virus to the nerves and enter the spinal cord, later end up in damaging the brain, and hence the people will get the rabies. And the dogs are one of the most important sources of the rabies. Always the dumb and furious forms are there, and it is one of the most confusing thing in the rabies. Then apart from this one, lot of awareness programs are also there to especially convey the people how to prevent the rabies. Maybe in Canada, I have also written so many articles, because the Lissa virus rhabdo, it's a bullet-shaped virus, and one need to be very careful about the rabies bite, because 96% of the rabies is spread through the dog bites only. Then every district, especially this is from the Shumoga, 10,000 rabies bites are there in every year in the Shumoga district itself. Hence, a lot of people will come and take the vaccination, especially from Shumoga district. And everywhere, the rabies is a one of the thing where in which the people have died, but after the bite of a rabid cat, especially in the Shikaripura. Then or Dharwad, the cat has rabid bitten cat has transmitted the virus, and the people have died. And many times the virus has been isolated by this examination of the brain, and also the recently, few of the cat-induced rabies is being reported everywhere, maybe Hubli or Betageri, then also from the Hubli. So this is the alarming thing, that even the uh, animals, especially the mad cats syndrome, pets vaccinated, but even in spite of that thing, they are transmitting the disease, especially in Pune also, a Jawan dies of rabies 11 years after the pet scratched him. So please see the incubation period of the rabies. 11 years after the scratches, not the bites of the rabies. And here you can go through the different sources are there, and every day we are getting the reports either in the social media or through the print media or the electronic media. So coming to the little bit more statistics about, sometimes the statistics also may vary. Then here it says that 55,000 deaths occur worldwide each and every year from the rabies case, and about 30,000 people have died from the disease, mostly in India itself. So, India occurs the topmost in the rabies, and statistics show that 99% of the deaths are due to the dog bites only, and many deaths may go unreported, especially in the village conditions. The people will never approach the hospital, or when the condition is very, very serious, then they may approach the hospital. So, the England, Japan, Philippines, and many other countries in the world have been declared as rabies free by WHO, but India, it's very, very impossible to at least prevent the disease. The deaths, later it's in 100% death is there. Then children under 15 years of the age account for 40% of the dog bites victim, as they start running when the dog chases. So this is an alarming thing. And coming to the virus, Lissa virus comes from the strain bullet-shaped virus called as the rhabdoviridae. Then this disease affects all the warm-blooded animals, and no animal is exempted from this one. Of course, the cases may not be reported. The animals most commonly affected by disease are in wild the wolves, foxes, dogs, rats, bats, mongooses, and raccoons, and also the cats. So the virus in saliva gets stuck in the wound caused by the rabid dog bite, and there are about 250 lakh dogs or 2.5 crores dogs which are totally unvaccinated, and they are all stray dogs. And there is one dog for every 36 people, the stray dog, and every 2 seconds someone is bitten by a dog in India and getting the vaccination, either vaccination, or if it is a rabbit case, then they are going to die. Then every 30 minutes the human dies of the rabies. Then 1,250 lakhs per year for the treatment cost of the rabies is there. Then vaccine 380 lakhs per man hours spent. This is the World Health Organization which reports this data in the year 2020. So it is totally a very alarming situation where in which a lot of educative programs need to be taken place. And even though the government of India and Karnataka are taking a lot of this thing, lot of awareness in the people is very much required. And even today, the India accounts about 60% of the people go to the village for medicine. That's the very unfortunate thing that the people still they think that rabies is cured by the folklore medicine, all from the plant sources. Totally a myth, and no plant can even reduce the symptoms of the rabies. And the death rate is among these people, especially rural India, then who go to the folk or healers, etc. The death rate is also very high. It's up to the 45%. Then 36% of the people who treat the dog bite wound with the village medicine, still they trust that the village medicines are very good for the people, and many claim that they have cured the rabies also, which is totally a misconception, and no such reports are there. And 45.3% people, local medicine makers are there, and only 40% people follow the modern medical treatment. This is a very unfortunate thing. The person who doesn't know about the rabies, or whether it's a viral disease, bacterial disease, etc., is going to treat the people, and the people are also such an uneducated, so that they will go to the folklore healers still, and the death rate among them is especially the modern treatment who go to the modern treatment, the death rate is very, very less. It is less than 1% due to the vaccination, then also the precautions, immunoglobulins, etc. So the rabies is a disease in human beings that can be 100% effectively controlled The people should remember this particular this thing. It can be controlled to the extent of 100% by vaccination and also followed by the therapeutic measures, the treatment with the immunoglobulins and also the antiseptics or whatever it may be, sometimes the antiviral drugs also. And the rabies control in animal is still impossible in India, and it takes several more years, maybe decades, as if you go by this particular speed. It's impossible to control because of the dog menace and also the non-vaccinated animals are there. And the people always do suffer from the dog bite and succumb to death by the rabies. Then in rabies, lot of different animals are also there, starting from a rat, deer, then wolves, fox, cattle, then also the cats, etc. Then the foxes are also transmitting the rabies. Then virus invade the wound, enter the nervous system, then through nearby nerves, especially they are deposited through the saliva to the nearby nerves and ascending, they go inside the brain, then destroying some of the main cells, the germ center, the dog saliva gland thereafter. Once again, they are secreted from the dog saliva. So, this is the way how it is going to transmit. And the rabies bite and dog, it gets the rabies by ascending movement of the virus, and later the brain is damaged and the virus locates in the salivary gland, and by the saliva it is transmitted by biting. Then some of the points need to be noted are the an infected dog transmission in the virus is to animals through only bite, no other means are there. It is normal for the cuts in parts close to the brain, such as the face, head, etc., to come early. But that doesn't mean that the other parts bites are also not dangerous. But it also depends upon the total quantity of the or number of the virus which is present per ml of the saliva, and also the site of the bite and post bite treatments. Then the people who has succumbed to the dog bite and the dog also, how much the types of the wounds, whether the wound grades are also. So it is not advisable to ignore any dog bite, including whether it's a normal dog or maybe the dog which is not diagnosed as rabies. So rabies does not have to come from dog bites alone. They can also come from the mongoose bite, then wolf and the cat, and also from the cattle, sheep, goat, pigs, whatever it may be. So instead, rabies saliva can also come in contact with the wounds and also the nose, then eyes. If it is spills in the eyes or the mouth also, it may come. So this is the rabies, especially in case of the world. So this is the country, Australia. There is no rabies as on date, and rabies present throughout the world, and there is no data in the white part, especially some parts of the Africa. There may be the deaths, but it is not reported. Whereas in Australia, no rabies cases have been reported since last many years. Then the human rabies deaths, the white areas are the one where the death rate is zero. For example, it is Australia, it is zero, whereas the light green, light yellow, it is nearing to 1 to 100. Here, Iran, then Mongolia, then the Philippines, then also the Indonesia, Singapore, and many more countries. There are very low number of the deaths. Then the more deaths are reported in the area, little dark yellow like China, 1001 to 110,000 per year. Then the Pakistan also, then Bangladesh, then also the other countries which in which the rabies rate is very high, and India tops number one. Here you can see highest death number of the deaths, more than 10,000 deaths per year. So this is alarming, and we need to take care of this particular problem. And especially this is the rabies report when compared to the Indian scenario. Especially this is the US data, and they have collected some data from 1955 to 2005, and of course the cases starting from 0 to 10,000. Then, of course, in the 1955, the especially the total cases were very high in the United States of America, whereas the domestic animals or domesticated animals, it is the next line, especially this thing, and wild, it is red. So wild animals always the rabies cases were fluctuating throughout the thing, whereas the domestic animals, it has drastically reduced in United States of America during last uh, so many 20 years, last not more than 20 years, 1955 to 2005, about 60 years. It has come down. And here there are a lot of data is there which says that the different countries, the number of deaths, especially in the year 2022, 21, then the 10, starting from 2010 to 2022. Here you can see the Afghan, the reported cases of the human rabies is 18 in the year 2022, whereas no data is available from 2010 to 2017, and later the ranges from 15 to 18. Then no data is available in many of the countries, and unfortunately, the data is lacking. And coming to the rabies in India, Uttarakhand and Chhattisgarh have the highest number of the rabies deaths, while Maharashtra, Gujarat, and Tamil Nadu have lowest. For example, the Karnataka, it is the death rate in per 1 lakh. So this is the 0.5% or less, the light yellow. This Maharashtra, then Gujarat, etc. It is less. Whereas the Karnataka, it comes in the 0.51 to 1.5 deaths per 100 animals. Whereas the Uttarakhand, you can see highest, above 3.5 deaths, and also the Chhattisgarh is the one where lot of dog menace is there. Then Andhra Pradesh, then the Orissa, etc. So all these states are highly affected with the rabies. Maharashtra, Gujarat, and Tamil Nadu, when compared to the other states, either maybe reporting may be low or they do not have the data. So Wilson and others have reported this in the year 2020. Then the Tamil Nadu has highest number of the dog bites, but the rabbit cases may be less. So here you can see the number of dog bites. So number of dog bites case reported by the different states, union territories in the year 2022, 22 totally. So Kerala 156 dog bites, then Tamil Nadu 1017 annual cases per 10,000 stray dogs actually. So the area wise it is very high in case of the dog bites, especially Tamil Nadu, and accordingly the incidences of course may be less, but dog bites are more. That means they are taking care, and overall it is average is 186 cases of the dog bites per 10,000 stray dogs. So this is a very high picture. Then dog bites per million population in the year 2024, 2014, and here you can see that the area which is shown in dark green is 20,580 equivalent. That's Tamil Nadu, Pondicherry, Andhra Pradesh, Gujarat, Uttar Pradesh, Bihar. Then followed by the Maharashtra, Karnataka, then the West Bengal, and also the next states are the Rajasthan, Jammu Kashmir, Ladakh, etc. So no state is devoid of the rabies, and every Indian state is highly prone for the rabies itself. Then this is the dog bites per million. This is the dog bites per million. Also in the year 2020, whereas this is the dog bites per million in the 2040. So what is the scenario now? This Tamil Nadu state still remains the top number one state The same type of the figures are maintained here. And Gujarat, then West Bengal are all worst affected states. Whereas the clinically suspected human rabies, not the animal rabies, during the year 2012 to 20 have been defected here. So the Maharashtra, it is about 907, Karnataka 10145, then the Tamil Nadu, it is 238, then of course the other states like Gujarat or Kashmir or Uttar Pradesh, there are no reports or human reports that may, whether they are there or not, maybe the reporting error may be also there, and the data is not there. Then here now number of reported deaths from the report from Central Bureau of the Health. So as the year passes, so the number sometimes it is increased 473, then 556 in the highest, then the lowest being in the year 2016, followed by the 110 in the 2018. Then in India, we can see the rabies cases, and in the year by 2005 to 20, especially joint point trend analysis of the rabies in India by the data is collected, and incidence of rabies by states, they have reported it, and we here you can see that the trend is fluctuating. In the 2005, it was very high, then it went up to the highest in the year 2006. Then slowly it is coming down. 2020, what we can see is the incidence is coming less. Whereas the rabies cases, the incidences are becoming less and less, maybe due to the awareness creation. And also the same is depicted as a graph here, then it is declining. That's also one of the good strength. As usual, the death rate of incidence of the rabies per 100 million population is 5.1 to 6.5 in Karnataka, then Kerala, then West Bengal. Whereas the other states have got different figures. So, what's the economic burden of the rabies globally? So travel cost is 2%. Then US million dollars, 8.6 million per year is invested in almost all these expenditures. So here productivity losses due to the premature death. Suppose a person or the children they die, then it is the productivity loss. Whereas the 0.01% deaths are the time is being invested, especially the it is surveillance, data surveillance, etc. Then 2% dog vaccination and population control, especially in the ABC programs, they consume the budget to the extent of 2%. Then livestock losses 6%. Then treatment cost is about the 15%, and totally it is coming to the medical cost of 37%, and direct costs are 20%. Then travel costs from one area to another area is also 2%. So ultimately it's becoming 100%. So this is the economic loss. And rabies in India, in some statistics, we can see that the animals, as on date, there are 28 outbreaks, and number of animals affected are 258, and death is 258 also. All have died. And this is the data from Government of India website, GADH, Government of India 2019. The outbreaks or the cases reported, only reported, I am saying, and many times the veterinarians are not in a position to report and confirm it. So hence the outbreaks may be very less, and number of animals are also buffaloes 25 and death is 25. Then sheep and goat, it's combined. Then total 10 outbreaks have been seen, and 41 animals have died. And dogs 23 outbreaks, 41 have died. And totaling this thing, it becomes the outbreaks is 246, then 383 affected, and all have died means 100% mortality is also seen. Then all these things, animals, the carnivores, they are, or the animals, biting animals, are the reservoir of the virus always responsible for more than 90% of the human deaths, whereas the cattle and other domestic animals play a lower role. Then vampire bats, the reports are not there in India and they are not there. So the bat oriented reports, one or two here and there, very few things are there. And these are all the vampire bats. And bats are the common sources of the infection. Then these are all the animals which do not spread the disease. The disease is not transmitted by the birds or the honeybees or by the bite of a snake or by the tortoises or tick bite. It is not going to be transmitted from one animal to another animal. And the different form of the rabies have been classified based on the clinical signs. One is the dumb form and another one is the furious form in which all the clinical signs are exhibited. Then the cats are becoming one of the important sources of the domesticated animal related rabies especially, and a lot of reports are being there in the throughout year. And here you can see that the furious form of the rabies is a very common thing, especially in case of the dog bites. A furious dog will bite. Then the furious bites are always the one which are going to kill more and more people from the stray dogs, as the molars or the canines. They are very sharp, and the saliva containing the rabies can be injected very deep inside the wound. Then the furious form of the rabies, most of the time it can be diagnosed by seeing the clinical signs, then also by the continuous salivation, then aimless running, and many more things. So, whereas the dumb form, it is very difficult. The furious form, of course, we can identify. The dumb form, it is very difficult, especially in case of the dogs. So, this is a picture with the uh, depicting that the humans have struck inside the mouth of the dog and also the domesticated animals, which the animals are showing the furious form of the rabies. Always the furious form of the rabies is expressed in case of dogs, and they bite many animals and also the human beings. Then the human rabies, lot of cases are also there, and they are directly from the dog bite. And sometimes the pet dog bites have also returned in case of the human rabies. Then the dumb form of the rabies, no clinical signs will be there. The animal will be morose in appearance, and the salivation will may not be less also. Then the animal may scratch, then the wound may created, and the dumb form of the rabies is very difficult to diagnose. Then they become the threat of the virus. The dumb form, there will be mild salivation, then sometimes the behavioral changes in the dogs, and suddenly they may go die. So the salivation will be drooling type of the saliva, especially in case of the dumb form. So the dogs will not bark or they will not bite any individual, but they are the potential sources of the rabies. Then the dumb form is not expressed very properly in case of the dogs, either large dogs or small dogs. Hence, they are very dangerous to the humankind. Then the cats are also one of the important source of the rabies, and nowadays they are all creating lot of outbreaks in case of human beings, and they scratch deep scratches, cause deep scratches, and the virus may enter through this wound, and the human being may get affected. So the cat induced deaths are already reported everywhere. Then the furious cats always the transmitters of the rabies, and the average incubation period of the rabies virus in human is 30 to 90 days average. But we can also see that sometimes it ranges from 2 weeks to 6 years, but the upper margin is also sometimes increasing. A person, a boy, after 11 years of the dog bites, cat bite has got the disease. And coming to the immunity type, both B and T lymphocytes are there. They may protect the body from the virus clearance. So here the very critically mediated CMI is there, cell mediated immune response, virus infection. It is perhaps the most puzzling of the host's total immune response to the rabies virus infection. So the helper T lymphocytes, which play an essential role in supporting the cell production and proliferation, and also the antibodies, because the people may always exposed to the rabies virus and may get some immunity, and they say that cytotoxic T lymphocytes, which function independently in the cell mediated viral clearance and are both key responses of the cell mediated immunity derived from viral antigens. So, the function of the CTLs or cytotoxic T lymphocytes is to destroy the target cells and display virus induced and changes on the surface of these cells. Whereas, in spite of their importance, viral clearance T lymphocytes appear to be suppressed in human animals and is infected by pathogenic this virus. A recent survey says that immunosuppression, the disease increases in severity and mortality rate, always is true in almost all the viral diseases. Then this is the way how pathogenesis of the rabies take place. Then rabies enters the inside the human body through the infected bite. Then it goes through the peripheral nerves, first in dorsal root ganglion, and later they enter the spinal cord. Then the virus infects the brain, and virus travels in the brain via the nerves and nerve tissue to organs such as eye and salivary gland. Then the virus infects nearby sensory nerves in peripheral nervous system. The virus replicates in the muscle cells of the bite, and it also replicates in case of the brain and also the muscles where it will get good protein. Then the clinical feature and diagnosis of the human rabies. Then we have got the described clinical sign are there: prodromal phase, then excitation phase, and paralytic phase. So, prodromal phase is the one where in which discomfort or pain at the site of the bite is there. So, then numbness and tingling above the limbs, then high body temperature, malaise, and sometimes severe headaches, then recurrent sore throats, then priapism is also another thing. And excitation phase is the restlessness, then tremors, pharyngeal nerve paralysis, fear of water in some animals, especially dogs, and terrier and excitement and respiratory arrhythmias, cardiac arrhythmias, hypotension, fear and convulsions, then intense thirst and dehydration, change in tone or voice of both human beings and also in case of dogs. Then lastly, the paralytic space. So here the restlessness, sometimes the convulsions, then flaccid limb muscles. Then sometimes the humans may also go unconscious, and finally it is leading to death of a human being. So this is the way. And here you can see that the human beings, they lost the sense of consciousness, and the lot of saliva is in the form of the foam is being secreted by such persons, and they are succumbed to die 100%. No person has could not make it success. Once the rabies clinical signs are expressed, then lot of headaches, then at the site of bite there is pruritus is also there, then the people will get lot of exhaustion, the recurrent sore throats, and ultimately the diarrhea and vomition. So the human patients who admit to the hospital will always have the furious form like this, which is shown. The person is having salivation, continuous salivation is there. Then his gaze is fixed at a particular space, and they die after few days. And here you can see that the human beings are chained or they are confined so that they should not cause any damage to the healthy one. So the always they will put a cuff to the hand so that they should not go out of the particular bed. And there are separate rabies beds are there or the wards are there in different hospitals to manage these patients. And the death is 100%. The rabies is also causing the severe convulsions, etc. Then the people who are suffering from the rabies will have the hydrophobia. But hydrophobia is not a common feature, especially in case of the cattle and also sometimes the dogs also. Hydrophobia, some owners keep the water in front of the buffaloes or the animals affected with rabies and see whether it drinks the water. But even the rabid these animals can also or they may drink water or will have the threat of the rabies. Then this is another case of the human rabies. Then differential diagnosis of rabies in human beings. In the initial phase, the locked jaw will be there. Then encephalitis is there. Then hysteria or aimless running and also this biting, etc. Whereas the paralytic phase is acute polyneuritis, polioencephalomalacia or myelitis. Then belladonna poisoning is also another suggestive, very clear to that of the rabies. Then delirium, tremors, then post-vaccination also got certain this clinical signs like rabies post-vaccinated encephalitis virus is there. Then Guillain-Barré syndrome is another syndrome where in which the patient or they are confined and later they'll test him for the occurrence of the rabid virus. And as usual, this is the way how it reaches the brain by usual the bite of a carnivore, then through the respective muscles which are present in that area, then the virus goes there, then it is going to cause either death or recovery of the animal. The same thing. Then the wild animals can also transmit the rabies, like the ferrets, hamsters, rabbits, and many more. And dogs being the number one. Then the diagnosis is by the clinical signs, whereas it has to be confirmed by the especially by FAT means fluorescent antibody test is one of the easiest method to diagnose the rabies. And ELISA performed by brain tissues is also another useful tool to confirm the rabies. So detection of FAT on the skin, biopsy, then antemortem biopsies are always studied by the veterinarians, or the virus is also isolated from the saliva, then all the secretions of the body without, if you do not take the pre-bite vaccination, it will be a painful thing, especially to the animal. and even the fat or the skin biopsies or fat positive after inoculation of the brain of the tissue, especially in case of hamsters. Then what they can see is the intracellular inoculation in the mice or the suckling mice. They have conducted experiments. The detailed rabies neutering or the antibody in titer in the CSF is already reported by Dr. Kavitarani, then Manjunath SS, etc. Then the detectable rabies is always there. And so the diagnosis method is detection of rabies antigens by the direct fluorescent antibody test, especially or FAT, DFAT, or ELISA, preferably the brain tissue collected with the postmortem. Also is another important method of detection, and detection by FAT on skin biopsy or antemortem or before, or fat positive after inoculation of the brain tissue, saliva or CSF with the culture, or after intracerebral inoculation of the mice in the suckling mice is also another method. The detectable rabies neutralizing antibody titer in the CSF or the serum is an unvaccinated person can also be another source, and detection of the viral nucleic acid by PCR tissue collected postmortem of intravitum in a clinical specimen can also be used as brain tissue, skin, cornea, urine, and the saliva. Then here the laboratory diagnosis is different methods are there: direct tests and indirect tests. In the indirect tests, the serology is there: ELISA, RF, FIT, then the IFA is the tests are there. Then means IFA means indirect fluorescent antibody. Then RFFIT means rapid fluorescent focus inhibition test. So these are all the indirect tests with the serum. Whereas the direct tests are the number one antigen detection, then molecular methods, then virus isolation. So the antigen detections can be done by the cellular staining or the D direct FAT fluorescent antibody tests. Then DRIT is also there another test. That's a direct rapid immunohistochemistry test. And RADT is rapid antigen detection tests are there. And the NAT is also for the molecular method, the rabies tissue culture inoculation test. Then the virus isolation can be done by MIT or the BT. MIT, then BT means by BT means biological test. MIT means mouse inoculation test. Or sometimes it is also done by the RTCIT means rabies tissue culture inoculation test. So these are all the laboratory diagnosis tests and ultimately. Then cellular staining is one of the oldest type of the staining wherein the negri bodies are observed under 1000x magnification. Then the recently the interpretation of RADT kits are supplied especially to different areas because this is the rapid antigen detection test where ADT is antigen detection test means directly it is going to detect the antigens especially in the brain. So the positive samples are looking like two bands should appear, the negative only one band, and the T band is if it's only present and C is not there means it is invalid, and no bands also it's invalid. So RADT is one of the easiest method of detection of the rabies. And rabies suspected sample, number one brain, then RNA extraction can be done by then RT-PCR can also be used for the Lissa virus RT-PCR. Then second RT-PCR reaction can also be done there with the rabies specific RT-PCR. And this is the nucleic acid amplification test or NAT protocol for rabies suspected sample based on the RT-PCR. Then the interpretation of nucleic acid amplifier test, especially results, the rabies suspected samples tested by the RT-PCR. So whenever the uh, different tests are there, then the bands, especially documented gel of the NAT assay for suspected samples, it will show the different bands, and accordingly the disease is diagnosed. So here BB hamster kidney BHK 21 cells. So no cytopathic effects will be seen in such thing, but if it is inoculated with the rabies virus, then cytopathic effects like this will be seen. And the antemortem rabies diagnosis is a toughest task, but it can be done in laboratory diagnosis of human rabies. So here the rabies RNA detection can be done in the saliva, then the nuchal skin, then the CSF. Then the negative samples are suspected that rabies cannot be ruled out if the sample is negative by any of these tests, and positive single multiple samples need to be laboratory confirmation need to be done, whereas the anti-rabies antibodies will be estimated in the CSF. If it is positive, then it will be subjected to laboratory confirmation. Then, if it is negative, then rabies cannot be ruled out. Then it can be subjected to repeat test after 7 to 10 days once again. Then, if it is positive, then need to be confirmed by the further tests. Whereas it is negative, then unlikely rabies, but cannot be ruled out also. So no test is perfect. Then the serum, if it is positive, then vaccination schedule need to be started. Then sometimes it is vaccinated, then sometimes not vaccinated, but everything has to be confirmed by the diagnostic tests. Then post-mortem laboratory confirmation always is done by the test brain tissue is, if it is available, then direct FAT or DFAT, then it's positive, laboratory confirmed. It is a guaranteed confirmed. Whereas negative, negative for the review, because this test is very specific. But if the brain sample is not available, then the nucleic acid amplification test can be done with other tissue, then nuchal skin or the CSF may be collected from the suspected animal. Negative in all the samples, rabies cannot be ruled out. Then positive in single or multiple samples, then once again it is to be reconfirmed by the uh, test rabies especially. So this is the characterization of histological lesions and immunohistochemistry of spinal cords in cattle and horse with rabies. So the slide A, lumbar enlargement, then marked multifocal lymphoplasmatic perivascular cuffs with multifocal necrosis or multifocal hemorrhagic areas are there. Here, a lot of hemorrhagic areas are there, where in which it's 100x hematoxylin and eosin. Whereas the slide B is the horse lumbar enlargement, then the Malaysia area characterized by large number of jitter cells in addition to the plasmocytic perivascular cuffing. So, lot of lymphocytes are accumulated here. Then the C is bovine sacral region, then marked neurophagia is always seen, whereas the D is bovine thoracic region here. Then immunohistochemistry stained neural pericardium, and it is stained with 3-amino 4-ethyl carbazole. Then coming to the animal rabies, of course, animal rabies is one of the important thing, and rabies is always spread by the dog bite as usual. Then it will go to the spinal cord, then to the brain, then expresses the clinical signs. So the rabies virus replicates to the greater extent in the muscles, then they enter the motor neurons which carry the symptoms, and the peripheral nerves are also being affected by the rabies. Then the animal rabies, especially they are uh, suspected cases and confirmed cases. In the number of cases in the range of 0 to 15, then dogs it is highest highest number of cases, followed by the camels, followed by the sheep, goat, wolves, cat, foxes, monkey, and some hyraxes are also seen in male species. Then after incubation period of 3 months, especially in the case of an animal bite, range 10 days to 6 months, dog may manifest one or more of the following clinical signs, or there may not be any clinical signs. There may be change in the behavior of the dog, change in the bark tone, change in the feeding habits. The animals may go off feed and eat abnormal objects. Or sometimes there may be fever, sometimes vomiting, excessive salivation. Then the animal may be paralysis of the lower jaw. Then anxiety, restlessness, convulsions will be there. And apart from this one, paralysis leading to death also seen in the different type of the animal. Then clinical picture of the cats. Cats also do suffer from the rabies. Rabid cats show extreme aggressiveness like this and great sensitivity to touch or noise. Then there will be profuse salivation. Then may attempt to attack dog or even man also, the cats. So one need to be very careful, especially the cat, because the teeth is very sharp in these animals. Then these are all the clinical signs of the rabid cat. Lot of salivation is there, aggressiveness is there, paralysis. You can see the hind limb paralysis, then sometimes the convulsions and the salivation. Then the dog rabies is also always the a case that is very common thing in many of the thing, especially the very commonly occurring thing. And this is the dumb form of the rabies, a confirmed case, but it is looking like normal with the little dermatological disorder. But this is a case of the rabies. Then here you can see that lot of saliva is flowing and involuntary chewing of the subjects, especially the dog. Then this is the dumb form of the rabies, the tucked up abdomen and the morose appearance, then depressive area and the gait, abnormal gait. Then clinical feature. What is the clinical feature of the cattle? Let us come to the cattle, etc. So the rabies is manifested as abnormal movements of posterior extremity. Number one. Then foamy yellow froth and a decrease in yield of the milk, sudden decrease in the milk. Then sometimes the bellowing is seen or severe aggressive nature is there. Then the hypersalivary syndrome. But sometimes the pruritus is a very characteristic feature. So the animals try to rub their skin towards the wall, etc. So the ataxia, then tenesmus is also another characteristic feature. Hypersalivation tending to attack and headbutting in case of bulls. This is also the characteristic. And many times none of these clinical signs will be seen and animal will be simply found dead. Then somebody do have the doubt that consumption of the milk and meat from rabid cattle is not advised even though it is not being transmitted, but not as advisable. Then no human rabies causes resulting from consumption of the milk and meat of rabid animals have been documented as on date. So one need not fear that if he or she has accidentally consumed the milk of a cattle, suffered from the rabies, and also the meat of a sheep, goat, or any other thing, then there are no deaths, etc. So no need to worry, etc. Then usually the pasteurization, boiling, and cooking kills almost all the viruses because more than 60 degrees Celsius, the virus will totally be destroyed. The rabies of the cattle is always a characteristic clinical sign is the continuous the salivation with lot of froth. It is not drooling, it is frothy salivation. Then sometimes aggressiveness can also be seen in some cattle, and continuous bellowing is another clinical sign in case of the cattle rabies. And the drooling above the saliva is another feature, and abnormal gait or behavior is another clinical sign. And sometimes the animal may also succumb from the Downers cow and try start convulsions. So this is the feature of the cattle rabies. Then sometimes here a cattle is affected by the rabies, and continuous bellowing is seen. Then the Downers cow, whereas in case of the animals, especially in case of buffaloes, they are going to head pushing, or always they will fight with inanimate objects. Then sometimes the sheep and goat also, a lot of clinical features are there, and these photos are obtained by Dr. Sunil Kumar KM from Shikaripur. From thanks to him. Then here the one of the buffalo which is affected from the rabies, it is hitting the tree where in which it is tied. So that is also another clinical sign. Especially in case of buffaloes, always they try to show this clinical sign. Then the cows, usually they bellow continuously sometime, and the frothy salivation and tucked up abdomen is another characteristic feature, especially in case of cattle. Then this is the one with head pushing is a classical clinical signs of the rabies. So whenever they are tied to a tree, they always try to push it or hit it several times, and this is another clinical signs in a bull. And some animals do always exhibit the continuous tonic and tonic convulsions, continuous flow of the saliva, what here you can see, is also another clinical signs of the cattle rabies. Then the buffaloes also show the continuous this frothy saliva, and the bellowing, continuous bellowing is also another clinical sign. And the tied rabid buffalo try to hit or push the inanimate objects. So this is the comprehensive analysis in context of world rabies. Hence, we are trying to cover almost all the species, starting from the human beings, then the dogs, cats, sheep, goat, etc. All the type of the comprehensive approach is there. So this is a clinico-pathological characterization of the rabies in cattle and horses. Here you can see that the horses trying to get up and the cattle is trying to get up, but hind limb paralysis is affected in both these animals. So the spinal cord is collected, then we can see that the cervical enlargement, hemorrhages in the area of the gray matter. All these things are the hemorrhages in both the cases. Whereas the horse spinal cord cervical enlargement, wherever the vertebrae are there, then hemorrhagic areas in white and gray matters, it is seen in case of the both horses and also in case of cattle. So the cattle, they try to show the clinical signs of the frothy blood always, then try to involuntarily chew some of the materials like grass, etc. But they are unable to swallow it. Of course, the goat rabies is also reported in different parts of the country by the Abdel Malik, etc. in 2021, and continuous bleating in case of the goat. Then the goats always try to bleed continuously, and sometimes there may be salivation or may not be salivation. Especially in case of goats, we cannot find much salivation syndrome, or sometimes it may be rare also. Whereas this is another thing where the sheep are affected with the different clinical signs of the rabies, and horse is affected and showing the torticollis and the donors and continuous convulsions. Then camel rabies is also reported in different parts, and here you can see that will be a characteristic paddling reflex will be present, whereas the continuous flow of saliva is another problem in these animals. Then we have conducted certain postmortem of the rabies with the help of Dr. Sunil and Dr. Nagraj in a nearby area of Osanagar. The brain sample are collected and they are tested for the lateral flow assay kit. And the buffalo rabies always they try to hit or push the wall very near to them. Headbutting is a very common feature in case of the buffaloes. Then continuous bellowing is another feature. Then here this is the rapid test kit. We have tested the sample which is belonging to a cow Raghupati of the Subbarao SK, then Basavapura village, then Hire Chittalu, then Karanalli Hosnagara with phone numbers also. So date of death is 7/10/2019 and the animal is a Malnargida animal, and here you can see that it is positive. The labs are there, lot of labs are there to confirm. NIMANS is one of the lab, whereas the QVF laboratory, diagnostic laboratory is also there, which is a OIE reference laboratory for rabies, which is located in Department of Veterinary Microbiology, Veterinary College Bala, Bangalore, since many years, and the brain samples are being tested here. So rabies is 100%. It is especially so, it is always better to zero the rabies by the year 2030, and every year 28th September the World Rabies Day is being celebrated. Especially the children are being affected to the highest extent, and one should not worry about the rabies vaccination. Many people think that the anti-rabies vaccination is causing some dangerous clinical signs, etc. Nothing to bother. It's all very safe, and always it is beneficial to the humankind. Then, especially, many myths are there about the anti-rabies vaccine. Don't hear to any of them and get the regular vaccine. They are very safe and tested from the topmost testing authorities. No side effects or adverse effects have been reported apart from a transient pain at the site of bite. That's all. And it's very routine in all the vaccines. Then the vaccine will be administered by the qualified persons like the nurses or the doctors, especially in the upper arm region, in the gluteal muscles. So it is very safe to take, and the course has to be continued whenever there is a dog bite, etc. Then 037 and the 28, etc. As per the doctor's situation, we need to follow that particular schedule. And the driving can be easily done after the vaccination. Nothing need to be worried, especially on the rabies, anti-rabies vaccination. So no drowsiness or nothing. It is not going to affect any of the body system. It is very safe, and one can easily have that particular vaccine and also the schedules. No adverse effects have been reported as on date. Then many people do think that it may cause the headache or dizziness or whatever it may be. Nothing is there. It is totally safe, and be cool and calm. Then the dogs need to be vaccinated regularly. Then another thing is the antibody titers need to be checked in the laboratory which is present in the Bangalore or somewhere else yearly. Then follow the properly the anti-rabies vaccine schedules. And whenever there is a dog bite, always classify it and get the vaccination and immunoglobulins. So here national guidelines which are recommended in India for post-exposure treatment against rabies based on category of the exposure. This number one is here you can see that this dog has bitten, but it is skin or anything is not involved, or upper layer of skin may be involved. So, category 1 bites, touching or feeding the animals, then licks on intact skin, and contact with intact skin with secretions of the rabid animal case, a clear rabid case. Then the recommendations are whenever we touch or feed the animal, no vaccination is required. If reliable case history is available, then if it is a rabid case and excretions of the rabid dogs have been contacted to the skin, wash the exposed area, water and soap and apply antiseptic. That is enough. So no need of the vaccination. Whereas the type 2 category is nibbling of uncovered skin, then minor scratches or abrasion without any bleeding, just like the dog scratches. Then the proper wound management has to be done with the antiseptics, then also washing with the soaps, detergents, and antiseptics, also the alcohol. And post-bite vaccination is required. In such case, always better to take the post-bite vaccination in consultation with that of a physician. And here the class 3 is single or multiple transdermal bite scratches throughout the skin is always the wound need to be managed with the standard protocol. Then immediately the rabies immunoglobulin should be infiltrated throughout the wound, and anti-rabies vaccines need to be compulsorily taken. Or if the leaks or broken skins are there, then contaminated mucous membrane with saliva, everything is there, then it is compulsorily the immunoglobulins, then rabies vaccine should be taken by 0, 3, 7, and 14, whatever may be recommended by WHO. Then this is the wound management in case of the animals, especially the wash all the wounds in the running tap water, physical and mechanical removal of the virus from the wound. Then use chemicals, wash all the wounds with soap water and apply the antiseptics like povidone or chlorhexidine or any other antiseptics which will inactivate the virus. Then biological method is infiltration of the rabies, anti-rabies immunoglobulins into the depth and around the wounds. In category 3 exposures, here category 3 exposures, deep wounds are there. Then neutralization of the virus will be caused. So do not touch the wound with bare hands. Do not apply the irritants like the soil, chilies, oil. Sometimes the people will always apply the lime, then some herbs, then chalk piece, betel leaves, nothing doing. Only use the approved antiseptics like povidone, chlorhexidine, Savlon, or many more things which are prescribed by the doctors. Then here the vaccination routes. Then many people will ask, what are all the vaccination routes and how to get the vaccination? After post-exposure prophylaxis or PEP, then pre-exposure this prophylaxis for the rabies adopted by NRCP. So the type of prophylaxis, post-exposure prophylaxis, route of the administration of the vaccine is intradermal, or if it intradermal, 0.1 ml per dose. The days of the dose 0, 3, 7, and 28. Injection per visit may be 2, and number of visits it will become 4. 1, 2, 3, 4. Then also intramuscular injection, entire vaccine vial need to be emptied. The same thing 0, 3, 7, 14, and 28 days. So the injections per visit is only one. The number of visits are totally 5. 1, 2, 3, 4, 5. The intradermal injection 0, 3, 7, and 14 days is skipped here, and it is on 28th day. So this is as per the NRCP. Then the pre-exposure prophylaxis. So if you want yourself to get protected against the rabies, especially this is recommended to the people who are always in the dog contact, like the veterinarians or animal handlers, trainers, breeders, etc. So they can take the intradermal injection 0.1 ml per dose at 0, 7, 21, and 28. So the each vaccine per is one injection, then three visits are enough for the total exposures. So here or it is not compulsory 0, 3 or 21, whereas intramuscular also it can be used. One entire vaccine vial can be used as 0, 7, 21 and 28, and the number of visits is one, especially the 3, and each time one injection will be given. So suppose a person which already has got the prophylaxis, but pre-exposure of the dog bite, etc. is done. Then the intradermal injection 0.10 ml per dose, 0 and 3 are enough. Only one injection per site and only two visits are enough. Whereas the intramuscular entire vaccine vial on the same days 0 and 3, and it is number of visits are less. Then usually the injection is given in the deltoid muscles, especially in the upper arm from the expert person. So protocol for the rabies, especially the post-exposure prophylaxis after annual bite, decision to treat the things are so category one. Already we know that the category one bites need not have any prophylaxis vaccine. Whereas the two, it always require the previously not immunized means we need to wash and everything we have seen, especially the thing. So that's about the, especially the category three, and so no bites of the dog should be neglected, and don't worry about the, especially don't worry about the vaccines. They are all very safe and very well manufactured, and also as per the international guidelines. And hence, one need to take this vaccine. Even after these things, so many questions will be remain in the mind of the people that, sir, I have got a dog, I have vaccinated it, and it has bitten my child. Whether to take the vaccine or not. Always better to take the vaccine because nobody knows how much quantity of the antibodies are present in the dog, even though it's a domesticated dog. And sometimes the people also ask the question, sir, I had already been vaccinated previous time, and while coming on the road, I got a bite from a stray dog. Whether to go for the vaccination or not, always better to go for the vaccination because we do not know that a stray dog is protected with rabies or not. And another question is, I have bitten with a domesticated dog, and the owner says that the dog has been vaccinated very properly from the veterinarian, whether I have to go for the vaccination or not. Then the question here is, the question here is whether to go for the vaccine or not. The thing it depends upon the recent vaccination history, whether the proper vaccines are used or it is uh, proper dosage is used, schedule is used, etc. Then the physician will decide whether to go for the prophylaxis vaccine, post-bite vaccine once again or not. Then somebody will have the question that uh, the poultry do have the rabies? No, the poultry there are no reports of the rabies. And sometimes the people always ask that I have been handling a dog and it has licked my skin, etc. Whether to go for the vaccine, not required. Properly wash it with the antibiotics and apply anti septic drugs, and nothing is going to happen. That's a good trade. And people will also ask the question that, yes, I have taken the milk of a cow, which is later diagnosed as the rabid animal. What I have to do? So usually in milk, the virus may be secreted. It is very less such, but the virus is very fragile, and hence one need not worry about this thing. and whenever the milk is boiled, no virus will remain, and it will be entirely destroyed, and you can be happily stay, and nothing is required. And sometimes the people say that I have consumed the milk of a rabid animal and I have not boiled it. Then also, the thing is two things. Number one, whether there was a wound in the mouth cavity, or whether the person has got the peptic ulcers or the esophageal ulcers. So, in such case, the if there are wounds, then as usual it has to be treated like a bite. Then all the vaccination schedules need to be followed. But the gastric pH of a human being is always very, very less, that is 2 to 3, and most of the virus get deactivated in that time, this in that particular thing. Hence, no need to have the vaccination of a dog. The owners will always ask the certain questions, and they say that I have got a dog and it has been vaccinated, whether to go for the vaccine. Yes, always better to go for the vaccination. Then the another question, I am tying the dog inside, and whether to go for the vaccination for it, always better to go for the vaccination, because it can be transmitted from the other animals like the rat, bandicoot, then the cat and squirrel, mongoose, etc. So always better to put the vaccination. Then the I have got a contact with the saliva of my dog, whether to go for the vaccination, but not required immediately. You can wash the wound with that of the antiseptics, and that is always better. How to carry my dog to the another country, then all the protocols of the taking the dogs to another country are very well there, and you please contact the respective embassies of different countries. So, lot of such questions are there, and I have bitten by a bandicoot or the rat or the cat. Whether I have to go for the vaccination or any other thing, because yes, surely, because these are all the carriers of the rabies, and you should go always for the vaccination. Then the rabies is not transmissible, and I do not know, some people will ask the pet owners, I do not know the date of the vaccination to my pet and whether I need to vaccinate or not. It is always better to get the dog vaccinated, because we do not know whether it is sufficient quantity of the immunity has come or not. So better to go for the vaccination. Then many people will ask, what are all the side effects of the anti-rabies vaccine? As on date, it's a tissue culture vaccine, and earlier the vaccine was not the tissue culture, and that was a painful procedure. But nowadays, nothing is done. So people will also ask the question that I have got a cat, and whether to vaccinate that cat or not. Yes, sure. The same type of the schedule which is put to the dogs need also be done by the cats. That's another thing. And there is no strain variation in the rabies. All are same. That's always a better thing, so that you can informally treat. Some people will also ask, my dog can be vaccinated with the tissue culture vaccine, that is for the human beings. Yes, already some studies are there, and it will give the sufficient antibody concentration, but the cost is very high, and of course, it is intended for the human use, and of course, more data is required. The people will ask, my dog has been vaccinated, but it has been bitten by a stray dog. Surely it has to be vaccinated, because nobody knows that what is the protective titer, especially you just come in the your dog. Hence, there is no time also. Hence, better to immediately get it vaccinated. Then how to confirm that the rabies has come or not? but there are no guaranteed tests. But it also takes much time and money, and hence better to vaccinate the dog. Or if the clinical signs arise within 4 to 7 days, then it will die. And people are sometimes going to ask the question that my poultry has been bitten by the mad dogs. What is the preventive measures to be taken? Of course, the answer is in poultry, nobody has reported the virus, especially the rabies, because the body temperature of the poultry is 107 degree Fahrenheit, and hence there is no question of the poultry will get that vaccine, even though it's a warm-blooded bird. But in 2015, few of the birds have been found, or poultry, some virus has been detected. Then lot of the papers are there. Infection domestic fowl. A report from India has been published by Julie Baby et al. Because the PLOS, neglected tropical disease. So it is published in 2015-22. So the natural rabies infection in a domestic fowl, the Gallus domesticus, a report is also from the India. Then my sheep has been supposed to have bitten with the dog. Can I sell them? Or if I sell them, if the rabies is there, can the others will get the infection? No, there is no chance. Even though the sheep and goat they are affected with the disease, if it is already known, better to avoid it. Or else, if it is not known, then uh, the meat is always in India. It is boiled, and in the boiling temperature, the virus will be totally destroyed. So human to human rabies chances are there because the people who is having the clinical signs of the rabies, there may be chances that the virus are shed in especially the saliva, highest extent, followed by the urine, then also the tears, etc. So then also the iris is also another source. Hence, there is a chance. Then another question from some of the owners, they ask dog owners, my dog is already pregnant and can I have the anti-rabies vaccine? The answer is yes, but during the vaccination process, please see that the dog is properly restrained and it has to be vaccinated properly, and there are no reports that the anti-rabies vaccine causes the abortion. But the abortion, if it is there, means it is due to the excitation of the dog. Then some people will also ask the question, I have vaccinated. Any food restriction to me? No, there is no food restriction. And only thing is the alcoholism is not better during the course of that anti-rabies vaccination. These are all the FAQs of the WHO website. And many times the people will ask the question that I have been vaccinated from the rabies, whether I will get the allergy or the vaccination induced allergies are there, then it's very rare case of the allergies getting, especially in case of anti-rabies vaccinations. Hence, nothing to worry about the vaccination, and get yourself very confident, especially about the rabies virus. And the take-home message is the dogs are always the source of the people. Of course, they are one of the companion animals, but be careful about handling and unnecessarily do not have the contact with that of the dog, and especially the saliva and other things are always they may be dangerous to the animal. And hence, people, and hence take care of yourself. And once again, the World Rabies Day. Happy World Rabies Day. Everything. Thanks. Goodbye. And have a nice day. Bye. See you all. Thanks.